Here in Studio 61 for our weekly Health Watch Wednesday segments with Dr. Syed Hussain from Trinity Health in New England. Good to see you again, sir.
Morning, thank you.
Yes, all right, let's talk flu. We've been saying it's looking like maybe the worst flu season in the past 5 seasons, but now they're sort of extending that out to say maybe the first since, about like 2009. What are we seeing that's changing that sort of estimation?
Yeah, Tim, so the CDC came out with a revised estimate last week, which basically states that the early trends indicate that we're probably in for the worst flu season in over a decade. So the last time we saw something remotely close to this was probably 2009. We've had over 880,000 illnesses so far. It's still early, remember, in the season, and over 7,000 hospitalizations with 360 deaths. Now, what this means, though, is nothing to panic, but we know that we have credible, safe, and effective influenza vaccine out there. People need to roll up their sleeves and get it, because the trends from the vaccination front also indicate that folks are really not getting the vaccine as quickly as they should.
Yeah, and now we talk about this in terms of a more holistic picture with not just flu, but there are obviously RSV infections in children's hospitals, and now COVID infections starting to rise up again. You said you saw some not so promising signs in wastewater, huh?
Yeah, wastewater surveillance from Massachusetts indicates that there's an uptick, a pretty high number in terms of what cases are being picked up from wastewater surveillance. It's a tool that's been used to detect any future potential surges.
Yeah.
So the coming weeks will tell us whether this translates into higher hospitalizations and more illness from a COVID-19 front. Now, at the same time, we are seeing in Europe trends that are playing out in terms of hospitalizations and rising cases in France, Germany, UK, and other countries. We know we typically lag a few weeks behind Europe in terms of COVID-19 cases.
And I feel like you talk about hospitalizations. That's sort of where all of these different problems, and no one of them is a disaster in the making, but they're all sort of kind of come to a head and put a strain on the healthcare system, probably more than anything else.
They do, Tim, but at the same time, I do want to reassure viewers that this is probably the time where we're most prepared in terms of taking on patients because of all the drills that we've been through over the last 2.5 years. Yeah. At the same time, we are battling, a tired, workforce, also a workforce where there are holes in terms of recruitment. So we are having our own challenges in the industry, but we remain ready to take care of patients.
Yes, and it's just been, I feel like 2020 never ended for a lot of people, unfortunately, in healthcare. Just fighting the good fight. Thank you so much for taking the time to join us. And thank you for all that you do and all the great people at St. Francis, too. Of course, Dr. Syed Hussain from Trinity Health in New England. He's with us every single Wednesday to talk about these topics over and over, and he'll be back again.